Hi, I'm Dave Jevsevar. I'm the chair of the Department of Orthopaedics and Regional Vice President for Orthopaedics for Dartmouth-Hitchcock. These times are unprecedented in that we've never dealt with a pandemic like this. The COVID-19 situation is challenging. It's often very frightening, but I think that we should be mitigating the fear that we've had to this point. We know, and it's commendable for the communities in New England, that we've done a good job to this point of doing things like social distancing, sheltering in place, limiting our outdoor contact, and all those things have flattened the curve, which we've all read a lot about over the past number of weeks and months. So I think that as we move forward, we are looking forward to how do we reestablish our normal way of life. We do suspect that it will be a new normal, even in healthcare. For us in the Department of Orthopaedics, we've been using an online platform for all of our patients that have had surgery. So with our platform, which is called Therapeutics, we want our patients to continue to use that platform, continue to log in, to continue to do their exercises, continue to fill out all of the forms and questionnaires that we have on the platform. For those patients that are involved with the platform, they routinely get text messages or emails. And we want to make sure that you continue to do those things. That not only helps us to know where you are along your pathway, but it also guides you along your recovery phase. We've also been working through this time period with telehealth and televisits, as we've not been able to safely see patients because of our personal protective equipment issues over this time period. So we have increased the number of other ways of meeting with our patients, and we've been able to do quite a bit in those modalities. And hopefully over the upcoming weeks, we'll be able to get back to what we're used to, which is seeing patients in our clinics safely, doing it intelligently, and figuring out ways that we can continue to move forward in delivering musculoskeletal health. Because of the situation in the pandemic, we've begun a number of new research protocols looking at how the COVID-19 pandemic will affect orthopedic care delivery, not only in New England, but across the United States. And it's already had significant impact, as we know, but we look forward to learning lessons so that if something like this were to happen again, we could be better prepared. In our world in orthopedics, a lot of our patients are having procedures like hip replacements, knee replacements, or spine surgery, shoulder surgery, and a lot of those patients are over the age of 60 or 65. So we want to carefully bring those patients back into the fold, carefully and intelligently, but most importantly, safely perform those surgeries when we are able to do so. For those patients who have a lot of medical problems or have a lot of respiratory problems, we may not be able to do those surgeries right away. But as we're able to do more surgeries and bring patients online to have surgery, we'll do it in a way that makes sense, in a way that's safe for all of our patients. Obviously, the COVID pandemic has been unfortunate for the whole United States, for the whole world, but it's been unfortunate for our orthopedic patients because many of our procedures are considered elective. And I certainly understand that if you have a bad hip or you have a bad knee or a bad shoulder, it doesn't feel elective to you. You're in pain and you're suffering at home right now. A couple recommendations that we can make to help you get you through this. The first recommendation for our patients, if you have a musculoskeletal condition, is to stay active. One of the things that's hard to do when you hurt is to get up and walk around or go outside of the house. But it's really important, as long as you can maintain social distancing, as long as you can wear a mask when you're outside of the house, that you get out and try to be active and try to do normal things. The other thing that can make any type of pain or musculoskeletal problem worse is depression. And it's hard not to be depressed right now. So getting out and doing all those things that you can do safely are really important to help the dysfunction and the pain that you're having. Lastly, there are several websites that you can go to, like the American Academy of Orthopedic Surgeons or the American Association of Hip and Knee Surgeon websites, which will give you plenty of information about other exercises you could do. Certainly for those patients that are on medications like anti-inflammatory medications, continue to take your medications, and if you need more prescriptions, certainly call us. We're available to do those types of interventions right now.